طيب hearing aids. hearing aids معناها بالعربي سماعات. تمام. طيب hearing aids يعني divided into two types, non-implanted and implanted. تمام. non-implanted and implanted يعني يتم زراعتها inside the body. تمام. non-implanted you can wear it. تمام. wear it like any other instruments يعني. تمام. طيب regarding the non-implanted hearing aids برضو عندنا different types اللي هي body worn hearing aids اللي هي placed on trunk يعني الطفل يحملك زي الشنطة like this هنا this child. تمام. wearing body worn hearing aids. تمام. It's the advantage of this type of hearing aids is easy to manage, but the disadvantages, it's clearly visible and has poor sound localization. Localization. Nowadays يعني rarely or unlikely to find يعني patient يعني wearing hearing aids like this, but you have to know إنه في type of hearing aid اسمها body worn hearing aids. طيب هنا the second type here behind the ear. The patient wear it behind the ear. The advantage here, adequate gain for mild to profound hearing loss. يعني from mild to profound hearing loss, that's the advantages. Can gain hearing أو adequate hearing for mild to profound. But the disadvantage here clearly visible. يعني أي أحد ممكن يشوفها تكون embarrassing to the patient يعني. The third type is inside the ear. Inside the ear. The third type is inside the ear. The advantage here, adequate gain for moderate to severe hearing loss. يعني less visible. تمام لأنها هي inside the ear like this. You can. تمام less visible. Okay. The disadvantage is difficult to adjust the setting of the hearing aids. Can be damaged by wax or moisture environment of the external ear. يعني ممكن يحصل لها damaging by this by the wax or by the moisture environment of the middle ear. Okay. طيب. The fourth type is inside the canal. Okay. طيب inside the canal is invisible and تكون جالسة inside the external canal. It's invisible. The disadvantage is هي limited to mild, moderate and severe hearing loss. يعني ما أقدر استعملها إلا في الرينج ده. تمام اللي هي mild, moderate and severe hearing loss. Okay. And it's difficult to adjust the setting. Okay? And can be damaged by wax and moisture. تمام. طيب. برضو hearing aids inside the canal, inside the ear, or even behind the ear can يعني predispose to middle ear infection. Can predispose to infection. تمام اللي هو not middle ear, I mean external ear infection. تمام اللي هي otitis externa. Okay. طيب دقيقة بس في connection problem يا شباب عالية وبعد معلش يا جماعة كان في connection issue. الآن رجعنا. طيب how it is limited despite it covers all the levels of لا لا it's mild, moderate and severe. في other يعني degrees of hearing loss. في moderately not mild to moderately severe يعني mild, moderate to moderately severe. في other degrees like severe and profound cannot be covered by this type of hearing loss. تمام. Does all non-planted types cause infection؟ أيوة ممكن cause infections لأنها يعني بتكون placed in the external auditory canal. تمام. placed in the external auditory canal. سواء كان inside the canal inside the or behind the ear. تمام. All these can cause يعني infection, predisposed to infection. تمام. Not middle ear but external ear infection, يعني otitis externa. طيب. The implantable hearing loss, the common example هو cochlear implant, cochlear implantation, if you hear about it, يعني implantation of cochlea. تمام. The indications هو البيشنت بيكون has severe bilateral to profound hearing loss, يعني indicated in a high grade of hearing loss. يعني ما ممكن أعمل cochlear implantation في mild or moderate, تمام, or moderate to severe hearing loss. Severe, the hearing loss must be severe to profound. يعني and some يعني literature يعني say that the indication is profound hearing loss. تمام. And hearing loss must be sensory neural. تمام. The problem within the cochlea. Okay. Conductive hearing loss, you cannot do cochlear implantation in case of conductive hearing loss, because the cochlea is functioning in case of conductive hearing. So cochlear implant for sensory neural hearing loss. One of the indication is congenital prelingual hearing loss. يعني congenital prelingual يعني before development of speech. تمام. So you have to do cochlear implantation in order to يعني to allow the child to hear well and to develop good language and good speech. And also in acquired postlingual, يعني patient has good hearing, then he developed hearing loss after development of the speech and language. So you have to do cochlear implantation in order to keep this يعني this skill and improve it. لأنه حتى في البوستلينجوال hearing loss after development of his speech وحصل hearing loss and the patient يعني not receiving يعني البرين بيحصل له شنو بيحصل له بيقول عليه زي not atrophy لكن بينسى الكلمات. Okay, so هيحصل deterioration in this skill. So also in post-lingual acquired hearing loss you have to do cochlear implant. على شرط يكون sensory neural hearing loss the degree from severe to profound. Okay. طيب. Yeah, cochlear implant يعني أعمل implantation of the cochlea. تمام. By يعني connecting arrays to the cochlea. تمام. With some processor outside يعني implanted in the mastoid bone. تمام. To collect the sound and process it and transmit it to the cochlea and finally to the brain. تمام. In order يعني to allow the patient to hear يعني. The second type of implantable hearing aids is BAHA أو bone anchored hearing aid. طبعا هو الموست severe. Okay, why use cochlear implant? Why just behind the ear? لا يعني طيب cochlear implant the indication هو sensory neural hearing loss. تمام. profound type لأنه behind the ear hearing aids ممكن استعملها as يعني initial state. يعني مثلا أخلي البيشنت using hearing aid for 6 months then cochlear implantation. Because the cochlear implant is less يعني annoying يعني like that of the hearing aids. تمام. And the child cannot يعني cannot tolerate the hearing aids. ممكن يقلعها. ممكن يطلعها. الهيرنج aids. Okay, unlike the cochlear implant. تمام. طيب, regarding the hearing, other implantable hearing aids is the BAHA أو bone anchored hearing aid. bone anchored hearing aids اللي هي BAHA. Okay, the indication هو child or adult with conductive hearing loss due to external or middle ear malformation. طيب, in this case, the hearing aid is implanted in the mastoid bone. تمام. As you can see, here is the mastoid bone هنا. Pointer. That is the mastoid bone. Okay, and that is the hearing aid implanted inside the mastoid bone. And to transmit the sound directly through the bone to the cochlea, bypassing the conductive pathway. Okay, transmit the sound directly through the bone to the cochlea. اسمها bone anchored hearing aids. Okay, in conductive hearing loss, the indication is conductive hearing loss. تمام. due to external or middle ear malformation. يعني مثلا patient has external canal atresia أو stenosis, middle ear malformation. تمام. مثلا congenital middle ear malformation. تمام. congenital external ear malformation. تمام. you can يعني do BAHA, bone anchored hearing aids. or patient with conductive hearing loss, تمام, with recurrent يعني acute otitis media. He used hearing aids, the usual hearing aids اللي هي inside the canal or behind the ear, and then causing recurrent otitis externa. تمام. So you can do this type of hearing aids, تمام, to avoid recurrent infection of the external canal, لأنه by time ممكن يحصل stenosis of the external canal. Okay, so better to do bone anchored hearing aid in recurrent otitis externa due to the non-implantable hearing aids. So that's all. Thank you. في أي سؤال؟ الشيء يعني عموما تعرف إنه في two types of hearing aids, في non-implantable and implantable. The non-implantable في هي behind the ear, تمام, inside the ear like this, within the ear or within the pinna, and inside the canal. تمام. The implantable in the cochlear implant and bone anchored hearing aid. The cochlear implant for sensory neural hearing loss and bone anchored hearing aid for conductive hearing loss. تمام. Due to external or middle ear malformation or patient with recurrent otitis externa. That he cannot tolerate the presence of the hearing aids. That's all. في أي سؤال؟ تمام.